Hi, my name is Dr. Aston Goldsworthy, and I'm a doctor here at Core Medical Center. We're talking about how to avoid a total knee replacement. This is another video in our series on that. Our last series, we discussed the 3 treatment methods we use in Synergy to treat the knee itself. We discussed proper assessment, physical therapy, and offloading the knee, which is one aspect of care called assessment and stabilization. And we talked about hydration, where we actually hydrate the joint with hyaluronic acid to increase joint space and to increase lubrication in the joint. Now we're going to talk about regenerative medicine, so stem cells specifically, and PRP, or platelet-rich plasma. So when when you develop articular cartilage damage and meniscus damage, hyaluronic acid can help heal some aspects of the meniscus, but it doesn't help this hard cartilage or this articular cartilage. The only thing that's going to do that is going to be stem cell. And so stem cell can be derived from several different areas. It can be derived from the patient themselves, from adipose tissue, or from bone marrow, or it can be donor tissue, or called allografts. We utilize allografts at our office. So we use a combination of stem cells and PRP to treat that area. We use what you call umbilical cord tissue, which is basically Wharton's jelly, which these are mesenchymal stem cells in high density that actually will regenerate tissue. And depending on the level of damage, it can regenerate the entire joint, or it will regenerate major aspects of it. Just like before, when we mentioned, precision guidance is key with this. Just getting an injection into the knee with stem cells isn't going to cut it always. Yes, stem cells have a special ability called homing, where they'll actually go to the area of injury, but you're going to lose some on the way. And so these are very expensive since they're not covered by insurance. So it's important that you have a provider that's going to put them where they're supposed to go, so that way you get as many cells as you can in there, and they get the best outcomes. The other thing we use is amniotic stem cells. Now, amniotic has very little stem cells actually, and a lot of patients find that like, well, then why are we using it? Well, it has a lot of growth factors, and these growth factors lay down a nice matrix or a scaffolding for that for those mesenchymal stem cells from that cord tissue to adhere to and to grow off of. And also, amniotic will actually reduce pain levels faster than Wharton's jelly or mesenchymal stem cells will. And the reason is it takes about 2 to 3 months for those stem cells to actually start doing things and making changes in here. And so that's a long time to wait for that patient. So they like to have, we like to give them something that's going to kind of give them a boost and decrease those symptoms early on in a healthy and effective way, not like cortisone where you're masking symptoms. We're actually, healing something in this. And then we mix that with PRP. And what PRP does is it boosts those stem cells. So we use kind of a stem cell cocktail. It's 2 different types of stem cells and 1 different type of regenerative medicine called platelet-rich plasma, which we actually take from the patient's blood. And so when you combine regenerative medicine, hyaluronic acid, physical therapy, and offloading, and to start off with proper assessment to make sure these treatments are going to be effective for that patient, you get amazing outcomes. And that's how you avoid a total knee replacement. Thank you very much for watching. If you have any more questions or interest, feel free to call our office or check us out on the web at coremedcenter.com.